So I want you to know there are a ton of different options for you when medications stop working for your erectile dysfunction. Don't feel helpless. Don't feel stuck. We're going to go through them one at a time, talk about the good and bad things about them. Stay tuned. Hey guys, Dr. Segal here. So the question is, medications don't work for my erections anymore. What do I do now? Super common question. We get this all the time. We have a whole series on kind of erectile dysfunction, testosterone, so check it out. You are not alone. It is very, very prevalent, common in the population. So let's go through them kind of step by step, the different options for you when the medications aren't cutting the mustard. At the end, guys, I'll talk to you about one of the newer therapies for erectile dysfunction, which is super exciting and doesn't involve medication. So make sure you stay tuned until the end to get that pearl of wisdom. First thing I tell guys, when somebody's tried one of the medications, one of the things that they really want to do is try another one. And there can be success when you try another one of the medications. If you're on sildenafil, you might have better luck with Cialis, but oftentimes that's not the case. The major difference from one medication to another is in the side effect profile. Okay, we have a whole series on these medications, so check out that video. But it's the side effect profile. It's not what we call the efficacy. It's not how well they work. So if somebody says they have visual problems or visual changes with sildenafil or Viagra, same thing, then we may switch them to something else, okay, tadalafil, vardenafil, to get rid of that side effect, not necessarily to get a better benefit. Don't get me wrong, I've had patients say that they have success with one medication more than another, but in general, the difference is side effects, not how well they work. So that's the first thing I wanted to just highlight to you. So you've tried all the medications, they're not working. What is kind of one of the next options? So injection therapy is a very reasonable next step. Injection therapy is where you apply a very thin needle, like the kind of needle that you might do for insulin, to the side of the penis and directly administer a medication to the side of the penis. Now, when we do that, we do a teaching session. You inject on either side of the penis. One of the questions guys often ask me is, all right, so I do this injection once and I'm good for months, right? That's not the way it works. Unfortunately, you got to do the injection every time you want to have an erection. Some guys will get an erection within 10 minutes. Sometimes it'll take a little bit longer than that when they apply that to the side of the penis. Works very well. But the problem is, as you can imagine, there's a fairly high dropout rate. And certainly there are some guys that say, no way am I going to do that. Okay, so it works, but high dropout rate, and a lot of guys just are not interested in doing it at all when they hear what's entailed with it. I've found that the guys that stick with it are the guys that have tried other therapies and figured that this is kind of the best option, and also the guys that have some familiarity with injections, specifically individuals with diabetes, because they're used to injecting themselves. So it's no big deal for them to do kind of one more injection. And oftentimes, when we'll talk about this in other videos, but diabetes is a risk factor for erectile dysfunction. So that's the next one, injection therapy. There's also a vacuum assist device, okay? So I'm going to talk about some of the details of it, but essentially it's a plastic tube. You insert the penis into the tube, and then either with a hand mechanism or an electric mechanism, a vacuum is created within that tube. That vacuum causes blood to rush into the penis and get you an erection. It usually takes about 5 minutes for this to happen. But there are multiple components to getting and maintaining an erection. First of all, we got to get the blood in, but the second part of it is we have to make it so blood doesn't go out. Okay. To that end, you have to apply a constrictive band around the base of the penis. All right. Now, that band can usually stay on for about 30 minutes or so in general. And it tends to be an effective treatment for erectile dysfunction. People say, what are the downsides of it? Well, I think the biggest downside is that it's cumbersome, right? So you have to plan it out. Sometimes it can be kind of difficult to generate the vacuum. People don't always like the constrictive bands. It does get rid of some kind of the spontaneity with having an erection. You have to certainly kind of plan it out in advance. So these are reasons why individuals may not be interested in the vacuum assist device, but it is very effective, to be clear. And the gold standard, so some people have tried all these things, they have mixed success with them, and they say they want something that is just going to get them a reliable erection. And a penile prosthesis is probably the gold standard for treating erectile dysfunction. A penile prosthesis, and we have a whole other video on penile prostheses, just you can check that out as well. But it has 2 cylinders that go in the penis, and this is a surgical procedure. The procedure is done usually as an outpatient, or you stay in the hospital one night. Anyway, there's 2 cylinders that go on either side of the penis, and there's a pump that's in the scrotum, okay? So everything's on the inside. People don't necessarily realize this. Everything is on the inside. Nobody sees this, okay? And when you want to get an erection, you just squeeze the pump. It recruits water from a reservoir, which is put just barely into the abdomen. It recruits water from that reservoir. It gets into the cylinders and you get an erection. You can generate that erection usually in moments. And then when you're done with sexual activity or having the erection, then you just press a button and then it releases the water back into the reservoir. So it works great. Usually the lifespan for a penile prosthesis is about 10 to 15 years, but it is a surgical procedure. And so when you tell, and that's maybe the biggest downside of it, is that when you tell somebody we're going to do a surgery to get you erections, they'll say, I don't care about it that much. But if it's important to you, I think you should really consider it because it works extremely well and they are far more durable than they were 10 or 15 years ago. So now I want to talk about a therapy that's not quite as sexy as the other ones, not like a one-hit wonder, but something that can put you over the top to improve your erections, and that's a healthy lifestyle. People talk about it all the time. I want to talk about a couple pieces of data that may convince you that a healthy lifestyle is helpful for your erections. So one thing you can do is just start walking. I remember reading this Harvard study one time that said that if you walk 30 minutes a day, you have a 41% chance less likely of getting erectile dysfunction, which is huge, right? So if you can just build that into your daily routine, 41% less chance of getting erectile dysfunction. So that's important, okay? Eating right? So what I consider to be kind of the erectile friendly diet in a matter of speak is fruit, vegetable, whole grains, fish. Avoid red meat, avoid processed food, avoid refined foods. Now, these are healthy lifestyle changes, but in general, that diet lends itself more likely to not having erectile dysfunction, okay? Pay attention to your vascular health. Remember, we talked about erectile dysfunction as a vascular problem or a problem with the blood flow that goes to the penis, okay? So when there's less blood flow, then you're less likely to get erections. So just a general checkup with your primary care doctor is super important. We want to check triglycerides. We want to check your cholesterol, check your blood pressure. All these things can affect the caliber of the arteries that go to your brain, your heart, and also your penis. And so to optimize that blood flow to the penis is going to make it so that you're less likely to get erectile dysfunction. Not to mention, it's going to improve kind of your overall longevity, etc. So the same factors that cause you to get, heart disease, stroke, etc., can cause you to have impaired erections. Now, as urologists, we're not the best at troubleshooting this aspect of kind of somebody's care, but your primary care doctor should be pretty darn good at it, so I would talk to them about that. Size matters, okay? So try to get slimmer. There is one piece of data that I like. A man with a 42-inch waist is 50% more likely to have erectile dysfunction than a man with a 32-inch waist, okay? That's super important. Obesity in and of itself is a risk factor for vascular disease, like we talked about, diabetes, okay, which is a risk factor in and of itself for erectile dysfunction. And it can affect your hormonal balance in your body. We have another video that talks about the relationship between weight gain and testosterone. Obesity can certainly decrease your testosterone values and predispose you to getting erectile dysfunction. So that's certainly important. Okay, so your pelvic muscles can sometimes constrict the flow of blood outside of the penis. So in general, there was a British study that showed that individuals that led a good lifestyle, did biofeedback, it did improve their erectile function. But when they paired that with pelvic strengthening exercises, their erectile dysfunction improved significantly more. And the reason for it, and there's, I guess it's more postulated or hypothesized, the reason for it is that if you have a strong pelvic musculature, then that can kind of compress the base of the penis or the area around the base of the penis so that when blood goes into the penis during an erection, it's less likely to flow out. And when it's less likely to flow out, you're more likely to maintain an erection. So there is a kind of a physiologic reason for it. What are these pelvic exercises? I usually tell guys they can start with just Kegel exercises. In fact, some of the guys that I do prostatectomies on, take their prostate out, I'll tell them to do Kegels before surgery to strengthen the pelvic floor for a variety of reasons. You know, you can look up Kegels, Kegel. There's a ton of different ways to do it. The easiest way that I think guys can remember it is try to mimic the same muscles that you would recruit or you would use when you're trying to hold on to your urine. So if you're peeing and you want to stop your stream and you have to get muscles to do that, that is essentially a Kegel exercise. So do that 10 times an hour while you're watching TV. That can certainly help things in the way of erectile dysfunction too. Some studies have shown. So that's another little tip that I'd like to give you. And this is my pearl of wisdom at the end, which is a newer therapy that is super effective and you should consider. And we do have another video on it, and it's called Gainswave or ultrasound treatment to the side of the penis. So it's a therapy where you come into the office, they apply a lidocaine cream or a numbing cream to the side of the penis. A probe applies acoustic waves to the side of the penis, and essentially it induces inflammation in the penis. And when that inflammation is induced or started in the penis, then it promotes the regeneration of blood vessels and even, they think, nerves over time, and can get you better erections. So we have another video about that. Gainswave is certainly something to consider. It's oftentimes not covered by insurance, so kind of the hardest part of it is, you know, the difficulty with shelling out the cash for it or your wallet, but that's something that you guys can think about. So I hope that's helpful to you. I hope that it gives you some kind of light at the end of the tunnel to know that, first of all, you're not alone. There's tons of guys that have problems with erections and medications aren't working for them, but don't feel helpless. Don't feel stuck. There are all these different options. Talk to your urologist about them. If you want to go for it, go for it. That's what I say. Thank you so much for listening. Please subscribe to our channel. We release 2 videos a week at least. Okay, thank you again, guys. We appreciate it.